Amoebic infections are a common infection, particularly when in patients that travel outside the country. So amoebic infections in general are a very low-grade type of infection. The symptoms of amoebic infection generally have to do with gastrointestinal symptoms, so nausea, vomiting, and particularly with amoebic infections, diarrhea that's not consistent is one of the hallmarks of amoebic type of infection. So you get diarrhea one day, and the other 2 days you're fine. So it's that on and off type picture that really classifies that type of infection pretty well sometimes. And so the number one thing that you always look for is travel history. And the second thing you look for is symptoms such as that type of diarrhea, very low grade infection. So it really doesn't give you a lot of symptoms in respect to fever or generalized malaise, amoebic infections are usually, we think of them whenever the patients present with that kind of scenario. The treatment for amoebic infections is, the number one is an antibiotic called metronidazole. And that type of antibiotic really takes care of most of the amoebic type of infections. And it's a simple treatment. It's an oral therapy. The patient is given an antibiotic course anywhere between 7 to 10 days of therapy. And that's usually enough to get rid of the infection.